In 1932, the United States Public Health Service, or USPHS, established a study entitled Tuskegee Study of Untreated Syphilis in the Negro Male. 600 black men were involved in the study, and their medical exams, meals, and burial insurance was paid for. 399 patients suffered from syphilis going into the experiment. 201 did not have the disease. All of the patients were misled as to the true nature of the study. None of the patients gave consent to the study, and none were treated with penicillin, the preferred treatment at the time, easily available and denied to the test subjects for decades. The experiment subjects were told that they were being treated for the inaccurate and broad disease of, quote, bad blood, end quote. The 600 black men were mostly poor sharecroppers, freed from slavery 67 years before, so that they could, in 1932, survive on $1 or few a day, farming and picking cotton for wealthy landowners, drowning in debt from the cradle to the grave. According to Thomas Merle, a United States Public Health Service doctor in 1910, quote, "The future of the Negro lies more in the research laboratory than in the schools," end quote. The study documented the course of an easily treatable disease in the bodies of these men over their shortened lifetimes. As syphilis develops untreated, symptoms include skin growths, sores, lesions, bone decay, and heart damage. The final stage of syphilis can take decades to develop and manifests in blindness, insanity, paralysis, and death. As Oliver Wenger, another doctor at the USPHS, concluded, quote, "We now know, where we could only surmise before, that we have contributed to their ailments and shortened their lives," end quote. Many USPHS staff were not very concerned about the welfare of their study participants, like Thomas Merle, who said of syphilis in the black community, quote, "The scourge sweeps through them. Those that are treated are only half cured, and the effort to assimilate a complex civilization drives their diseased minds until the results are criminal records. Perhaps here, in conjunction with tuberculosis, will be the end of the Negro problem. Disease will accomplish what man cannot do," end quote. The USPHS described blacks as, quote, "a notoriously syphilis-soaked race," end quote. So the way this experiment went wrong, originally proposed as a genuinely beneficial healthcare program for Macon County by Booker T. Washington and Julius Rosenwald, was through bigotry and ignorance, an unfortunately well-traveled path. Rather than dispensing effective treatments as planned by Rosenwald and Washington, public health service doctors gave out vitamins, insignificant doses of arsenic, which was a syphilis treatment in the early 1930s, and mercury salve to those African Americans suspected of having the disease. Mercury is highly poisonous and could have caused any number of nervous system and neurological problems. After hundreds of syphilitic black men were identified in Tuskegee by United States Public Health Service doctors and given ineffective medications, memos sent out to the ostensibly treated patients from the USPHS read, quote, "This examination is a very special one, and after it is finished, you will be given a special treatment. Remember, this is your last chance for special, free treatment. Be sure to meet the nurse," end quote. Raymond Vonderlehr wrote to a colleague that, quote, "It is my desire to keep the main purpose of the work from the Negroes in the county," end quote. Wenger wrote to Vonderlehr that, quote, "There is one danger in the latter plan, and that is if the colored population becomes aware that accepting free hospital care means a post-mortem, every darky will leave Macon County," end quote. The USPHS consequently focused on pretending that they were giving effective treatment to the non-consenting test subjects and made sure that all study-related deaths should occur in the clinic of the only black doctor in Macon County at the time, to allay community suspicions that the USPHS doctors were doing exactly what they were doing, letting African American men die from a painful, protracted disease so the United States government could open them up and look inside. To minimize the chance of any Tuskegee subjects receiving treatment, the subjects of this study were monitored very well, to the point that many received no treatment for 40 years. In 1934, the USPHS doctors met with local black doctors and asked them not to treat the men in the study, which was agreed to. Syphilis treatment clinics became available in the 1940s, where a single shot of penicillin could manage syphilis easily. Clinics near Macon County were given a list of names of the Tuskegee trial subjects, who were categorically denied treatment. As the years passed and the test subjects died, the USPHS performed autopsies and published articles in medical journals, even giving talks about the study results at a 1936 American Medical Association meeting. The AMA report revealed that 84% of the infected subjects displayed symptoms of their disease. By 1955, other than the development of a more effective test for syphilis, the drawn conclusion after so many autopsies was unremarkable and expected, that over a third of the expired black men had died from syphilis, and many of the surviving subjects were suffering from intense symptoms. At least 19 children from families taking part in this study were born with syphilitic birth defects. Known syphilitic birth defects are bone damage, anemia, misshapen organs, jaundice, nerve problems, blindness, deafness, meningitis, and skin rashes. Most Tuskegee study subjects were over 70 years old by the end of the 1960s, feeble, still poor, and severely ill. Tracking was becoming more difficult, as the doctors and assistants in the study were aging as well, and could not spy on or manage the subjects as easily as before. In 1965, the Students for a Democratic Society found out about the Tuskegee syphilis study and tried to organize protests, but were dismissed as extremists. A record of a 1965 meeting at the Centers for Disease Control touches on the issue of disclosure. Quote, "Racial issue was mentioned briefly. Will not affect the study. Any questions can be handled by saying that these people were at the point that therapy would no longer help them." End quote. An interviewer named Peter Buxton found out about the study and wrote to the PHS for 7 years, trying to urge them to end the inhumane and unethical study. The department ignored his pleas entirely. Finally, in 1972, by which time over 100 subjects had died from syphilis, Peter Buxton told his journalist friend, Gene Heller, about the study. Heller investigated and subsequently reported publicly that this syphilitic experiment on black men had been going on and was still going on after 40 years. As a result of this reporting, the Assistant Secretary for Health and Scientific Affairs appointed a panel to determine the scientific validity of the study. The panel declared the experiment, quote, ethically unjustified, results disproportionately meager compared with known risks to human subjects involved, end quote. The panel further concluded that the testing was, quote, ethically unjustified both when it was initiated and after the discovery that penicillin was a safe and effective treatment, and that policies and regulations to protect the welfare of patients in health research were inadequate, and that a formal department needed to be instituted for the regulation of human research. End quote. Even within the advisory panel, problems and altercations occurred. Jay Katz recalls that Broadus Butler, the panel chairperson, quote, constantly slowed us down, end quote. Fred Speaker says, quote, Butler, I think, wanted to keep things status quo. Although we had given instructions to stop the experiment was still being conducted. What I remember saying is, stop fucking around. Let's do something. End quote. A comprehensive audio recording of many scientists and staff personnel involved with the Tuskegee study was agreed by the panel to be destroyed. Vernal Cave, another panel member, says, quote, we interviewed the victims, Nurse Rivers, the sociologists, everyone. We had them all on tape. I went along with destroying the tape. End quote. Cave and Katz assert that Butler recommended they destroy the tape, and Katz recalled, quote, "I unfortunately went along with it. I wish we hadn't done so. We hadn't done our job well." End quote. The tape ended up being burned. When the report was submitted and the panelists received their copies, the cover letter weakly exonerated Butler of his responsibility for the ruling and read, quote, "The final report of the Tuskegee Syphilis Study Ad Hoc Advisory Board is transmitted herewith. The chairman specifically abstains from concurrence in this final report, but recognizes his responsibility to submit it." End quote. In October 1972, the panel advised the USPHS to stop the study. After a month, the Assistant Secretary for Health and Scientific Affairs, Merlin Duval, sent out a memo that read, quote, "I have decided that the Tuskegee study, as a study of untreated syphilis, must be terminated. I will advise you of the necessary steps to be taken to assure that appropriate medical care be given to all remaining participants in the Tuskegee study." End quote. Merlin Duval also stated, quote, "I wanted a panel that would be sympathetic to the public point of view, so I loaded it with angry blacks. That way there could be no criticism." End quote. A class action lawsuit was filed by the families of the surviving members of the study and was settled out of court for $10 million. 400 of the 600 unwilling participants made to live with syphilis and denied treatment for decades, for up to 40 years. Apparently, reparations of about $417 a year seemed appropriate. A little under $17,000 total per family for an unethical, unconsented-to study conducted for 4 decades. 65 years after its perpetration, in 1997, President Bill Clinton formally apologized to the 8 surviving members of the experiment and their relatives. Quote, "I say what you know. No power on earth can give you back the lives lost, the pain suffered, the years of internal torment and anguish. What was done cannot be undone, but we can end the silence. We can stop turning our heads away. We can look you in the eye and finally say, on behalf of the American people, what the United States government did was shameful, and I am sorry. To our African American citizens, I am sorry that your federal government orchestrated a study so clearly racist. That can never be allowed to happen again." End quote. Unfortunately, this was not the end of cruel human experimentation, in the United States or elsewhere. Inhumane treatment by inhumane people, prejudiced experiments, and bigoted reactions, effected against a chosen race, culture, class, religion, or any characteristic that does not solely define an entire complex being, happened and happen all the time. The Tuskegee study of untreated syphilis in the Negro male started in 1932, what may seem like a different time, and was allowed to continue until 1972, a time that may not seem very different. Whatever cultural differences might exist along that spectrum, the human differences are non-existent. The 600 black men experimented on for 40 years are the same as any 600 black men today. Those humans deserve the same rights as any 600 humans today. Respect people for being of the same flesh and blood that gives you the facility to appreciate the life you've created for yourself. Everyone should enjoy this facility, this universal, humane respect,